Not too long ago, actress Letitia Wright, known for playing Shuri on Black Panther, came under fire after posting on her Twitter account a video by Tomi Arayomi, in which Arayomi questions the safety of an up-and-coming coronavirus vaccine. Also, in this video, Arayomi makes some statements that some people deemed transphobic, and he seemingly blames the Chinese people for spreading coronavirus all around the world. Letitia Wright engaged in some conversations with people on her Twitter account saying why she posted this video after there was so much controversy, and a day later, she actually posted a statement on her Twitter account saying that she was only trying to spread information that she thought could help people that were a little weary about the coronavirus vaccine. Later on, Wright ended up deleting her Twitter and Instagram accounts, and the Arayomi video was removed from YouTube for violating the community guidelines. It should be noted, however, that both of their concerns are not out of the ordinary regarding the coronavirus vaccine, especially when you look at Americans, Black Americans specifically. We're very skeptical. The coronavirus has affected people all around the world, especially in the United States, where cases continue rising and deaths continue happening. One group that's been impacted by coronavirus on a major, large scale has been the Black community, and that's why there's been this push nowadays to get the Black community to take this vaccine that will be coming out soon. However, many Black people are weary of doing so because of the history that America has with treating this demographic when it comes to healthcare. Shall I go back? Alright. So first, there's the infamous Tuskegee syphilis study, which took place in Macon County, Alabama. In this study, 600 Black men were looked at to see how syphilis affects the human body. The study comprised 399 Black men with syphilis and 201 Black men without syphilis, used as a control group. None of these men consented to be in this study, and even after a cure for syphilis came out, the people with syphilis were not given this cure. Instead, they were left to die with syphilis, and the researchers in this study looked at how the disease impacted their body after they were dead. Then we have Henrietta Lacks, who was a Black woman who was an American descendant of slaves, and she died from cervical cancer, an aggressive form, at the age of 31. After she died in Johns Hopkins Hospital, the healthcare workers that were there took some of her cancerous tissue to experiment on to see how it reacted after her death. What they found was that this cancerous tissue continued to replicate and grow even after Henrietta Lacks had passed. And thus you have HeLa cells. These cells that were derived from Henrietta Lacks were used to, and have still been used to, help with diseases, help with different cancers. People have made millions of dollars off of this. Unfortunately, Henrietta Lacks' family still has yet to be properly compensated for her cells being taken without her or the family's knowledge. Going to the 19th century, we have James Marion Sims, who experimented on enslaved Black women. He's considered the father of gynecology. However, these enslaved Black women that he looked at, they weren't giving anesthesia when he was conducting these experiments, so they were subject to much pain and trauma. If we look today with healthcare workers or the healthcare industry, Black people deal with much discrimination and racism. First, we have the issue of Black people getting proper healthcare. Because of a history of systemic racism and discrimination, Black people have been unable to get proper economic opportunities in order to afford proper healthcare. Then you think about individuals who live in the ghettos, who live in urban areas with food deserts, food insecurity, and they aren't given the proper resources. They don't have adequate neighborhoods to play in. You deal with Black people having some lead poisoning. Then you have the Flint, Michigan situation where some Black people aren't able to have good water in their neighborhoods, which leads to further health ailments. Even when Black people get healthcare treatment, they're still discriminated against. To this day, Black women are 2 to 3 times more likely to die when delivering a child as opposed to white women. Then there's this racist notion that Black people can handle more pain than the average person. On top of that, Black people are less likely to receive proper cancer or diabetes screenings. And you wonder why this demographic isn't too keen on taking the coronavirus vaccine. History shows us that when Black people interact with the healthcare world, it could be dangerous or potentially fatal. So what can be done to rectify this? What about solutions? First, people need to understand that healthcare has been racist towards Black people over the course of American history and in present day. Recognizing this is the first step, but also we need action. So people who are healthcare professionals need to be trained in cultural competency and cultural humility. Although no one can be truly competent in another one's culture, learning about different cultures can help with implicit and explicit bias. Studies have shown that when Black individuals are paired with a Black healthcare professional, better healthcare outcomes are the result. Medication adherence improves, and there's more empathy because if a person is of the same race as you, more than likely they're going to understand your plight. They're going to understand where you're coming from when it comes to healthcare matters. Reaching out to community organizers and youth leaders in Black communities can help as well, because if you can convince trusted leaders that a certain vaccine is safe or a certain health practice will not harm Black people, then they will spread the word and more Black people will buy in. So yeah, I understand Letitia Wright and Tomi Arayomi's point about being cautious about the coronavirus vaccine. I mean, even there are reports saying that Africans are being used to experiment on. So I can understand how Black people globally would be hesitant to take any vaccine. So let us at Chemistry Productions know your thoughts on this topic right here. Make sure to leave a comment in the comment section down below. Also like and subscribe to our YouTube channel. Thanks for watching.
Chemistry Productions.